Good night, sir. This is Mario Lopez. I'm going to be taking care of you today, okay?
Okay.
So this video is going to be for the musculoskeletal assessment of the hip and knees, okay? So to begin with, the joint of the hip is to a place very internally, so we're not going to be able to really visualize unless there's evident swelling. So we're going to go ahead and start with range of motion. So with the legs straight, extended, we're gonna rotate the hip one way and the other. Where during all these range of motion exercises, we're gonna be assessing for range of motion, limited range of motion, passive, active range of motion, passive and inactive, and for any pain or any complaints from the patient. So if you feel any pain during this test, please let me know. Okay. And then we're gonna go into the other leg, and we're gonna, with the leg completely extended, we're gonna rotate the hip internally and externally, assessing for any pain. So after, I'm gonna assess for active range of motion. For the purpose of this test, this is the best we could do. We do not have an exam table, so we're gonna try to do our best every single exam, or if not, we're gonna verbalize it in every single assessment. So can you please flex your hip, bring your knees to your chest, both, the other one. Thank you. So we're gonna have to look for symmetry of the movement, pain, range of motion. That is active. If it was that's a flexion. If it was extension, I'll have the patient prone, and then he would be moving the leg into the air or we can have the patient on the edge of the table and have the patient completely extend the hip, or on the side and extend the hip. In this case, we're not going to do it, but we'll be assessing for any pain in both sides, right and left. So now we're going to start passive range of motion. So I'm going to be flexing the knee. Any pain?
No.
And we're going to do the other side. Oops. Okay. So now we're going to do adduction and abduction, okay? Again, looking for any pain. So I'm going to support this one. I'm going to hold out with the leg straight. There'll be abduction and then adduction. I'm going to hold like this. Bring it towards midline. We're going to do the same thing here. And then the other side, I'll do on the other side. Any pain?
No.
No? Okay, you're doing okay. So then we're going to do internal rotation and external rotation of the hip. So we're going to get the knee, the hip at a 90-degree angle. And then we're going to do externally rotate. We're going to do internal rotation. Any pain?
No.
We're going to be doing the same thing again for the other leg. Any pain?
No.
Any pain?
No.
Okay. That's what we're going to be doing. Okay, so now we're going to do the Thomas test, which is for to detect a cold or hidden contracture of the hip. So what we're going to do is we're going to be doing flex your hip, and you please hold your leg to your abdomen as much as you can, and then the patient supine, we're going to be assessing for the elevation of the opposite knee from the table. If there is elevation of the knee and it's not completely flat against the table, then there is a positive Thomas test. And again, that is we can assess the resistance of the extension of the knee in the table, but that's for a session. You can go ahead and release. That's to assess a hidden contracture of the hip. Okay, that would be a Thomas test. And then the other test is Patrick's or favorite test. It is an assessment of sacroiliac disease. And what it does, favorite test is pretty much what it stands for is have flexion, adduction, so we can do the right or the left. Put it on the on top of the distal portion of the femur. So that's flexion, adduction, and then we're gonna put pressure down towards the table and the knee. So you let me know if you have any pain, okay, in your hip or in your lower back. So we're gonna be pushing down. Pushing down. Do you have any pain?
No.
Okay. Those are the favorite tests for sacroiliac disease. Okay, so that is it for the hip. Now we're gonna go ahead and start with the knees. So with the knees, we can do a little bit of inspection. So with the knees uncovered, of course the patient should have a gown and be completely uncovered. We're gonna be assessing for the configuration of the knees, meaning Bogum or Verum, Bogum, knock knees, Verum, bow-legged. We're going to be assessing for the symmetry of the joints. We're going to be assessing for any swelling, any redness, any deformities. For the hollow spaces on the patella, we're going to be looking the normal hollow spaces on the sides. We're going to be assessing for any of those abnormalities. We can assess for the musculature itself, for the quads, the quadriceps over here, how it is any muscular atrophy. The bulge sign. Would that'll be on palpation. So what it is, the bulge sign, you're gonna be palpating on the suprapatellar notch, suprapatellar pooch, sorry, and you're gonna be holding down, and you're gonna be kind of milking the suprapatellar pouch to the medial aspect of the knee. You can see over here. You're gonna do it in the medial aspect, and then with your opposite hand, you're gonna be touching the knee right here, and then you can release, and you can see if there's a bulge coming out of like fluid. As for a knee effusion, that's a test for fluid in the knee. So again, suprapatellar touch, and then medially you kind of milk it down, and then you press, let go. In this case, it's negative. There was a knee effusion. You will see the bulge come out in the knee. You can do it in both sides to see any after any trauma or any complaint of knee swelling. After that, so you're gonna be palpating. You're gonna palpate the suprapatellar pooch and both for any swelling, any both sides down with your like this. There's no swelling. You're gonna palpate it immediately. Can you please get it close? Right there. You're gonna palpate the patella. Any movement on the sides, any pain, any crepitus, both. And then with both of your thumbs, you're gonna find the joint and the femur and the tibia, and you can flex it a little bit. This. You're gonna on the side of the patella, you're gonna palpate. You have any pain?
No.
No, palpate medial and lateral, both. For any pain? You have any pain?
No.
Okay. That's what you're gonna be doing for the palpation. So for the knee, now can you extension? You can extend it at 0 degrees. So patient being supine, that's extension of the knee. Can you please bring your knee in the air? To your chest like that. So that's flexion, and the other one. Okay, now you're gonna feel for symmetry of movement, rhythm of movement. And now we're gonna be testing for the ligaments. Okay, so we're gonna be applying valgus pressure, and varum pressure. Okay, so that is to test the medial and lateral. The medium and lateral collateral ligaments of the knee. Okay, so pretty much what keeps the knee in place. So slightly flex the knee, and I'm gonna be supporting the knee, and with my left hand kind of pushing inward, and my right hand outward, and like that. That's Bogum pressure. Then the other side. Then we're going to do the opposite. Put the hand on the inner aspect, the medial aspect, and the right hand on the lateral, and we're going to be pushing opposite direction. And we're pretty much assessing the collateral ligaments. What we're doing is the medial ligament, medial collateral ligament goes from here, and the lateral goes from here. So we're just applying pressure, Bogum and varus pressure, and the other knee is the same thing. Any pain, you have any pain, you assess it the same way as the right. Then after that, you're gonna do assessment for the specialty test for the There's two tests for the anterior and the posterior cruciate ligaments, the ACL and the PCL. Okay, so the first one is the drawer test, where you're gonna have the patient bend the knee, and you have the foot completely on the table. And in this case, you could sit on top of the patient, on top of the foot, so it won't move. In this case, we can't do that, but I'm gonna put my knee. You can do this, and then what you're gonna have to do, the femur is stabilized already. So you're gonna get the tibia, and you're gonna pretty much pull it. You can't see it, but you're gonna pretty much pull it towards you. Pull it towards you. And if there is you can see if there's if the tibia comes towards you, if the patient has any pain, it's a positive drawer sign for the anterior cruciate ligament, and then you can push anteriorly and posteriorly for the anterior and the posterior cruciate ligament. That is in both knees. Now the Lachman test, you're gonna have the knee slightly bent. You're gonna secure the femur in place, and then you're gonna put your thumb in the tibial tuberosity, and you're gonna do this range of motion. You're gonna be pulling the tibia, and you're gonna be holding the femur in place. So to assess for the anterior, the status of the anterior cruciate ligament. That's in both knees, and again, that is the Lachman test. Now for the last test, we're gonna do the McMurray's test, and that is an assessment of the meniscus, the medial and the lateral meniscus. Okay, so I'm gonna hold the knee, and I have to sorry, I'm kind of trying to remember here. So we're gonna hold the knee, and I'm going to, it's like this. So I'm gonna be extending the knee, while at the same time I'm rotating the tibia. No, it's like this. Sorry. Now I remember now. So you gotta put one hand in the heel, and then the other one on the joint, and you're gonna be rotating, and you're gonna be extending, and it is assessing for the medial meniscus, and then you can do that for the other side. I'm gonna be doing this. You're gonna be extended. You have any pain?
Wow.
That's for the other side, the same thing. Again, the Murray says the McMurray test, and that is assessing for the meniscus, the medial and the lateral meniscus. I think that's it. Thank you.